So what is World Oral Health Day's purpose? Well, World Oral Health Day aims to empower people with the knowledge, tools, and confidence to secure good oral health. Why is World Oral Health Day important? Well, oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they are often linked to other serious health issues, and yet there's no reason to suffer. Most oral health conditions are largely preventable and can be treated in their early stages. So, the interview brought to you in conjunction with Masoodah. Masoodah's vision is to be recognized as the trusted leader and voice of oral healthcare in Southern Africa. Their mission is to promote the interests and serve the needs of their members, and above all, encourage optimal oral health care for all South Africans. South African Dental Association, check them out on their website, sada.co.za, www.sada.co.za. And also check out the Young Dentists Council by visiting www.sada.co.za/young-dentists-council-YDC. So today, I'm going to be talking to Dr. Masoodah Essop. And of course, the theme for this year is Be Proud of Your Mouth. So, Dr. Essop qualified in 2017 from Wits as a dentist and currently working at Fresher Breath private practice situated in Mill Park Hospital. Dentistry is not just a profession for her, but a passion for Dr. Essop. And this is why always tells his patients that they are not just a set of teeth working through that door, highly driven and motivated with special interests in aesthetics and rehabilitation dentistry, believing in delivering patient-driven care that is holistic. Someone once said, a smile is a curve that sets everything straight, and leaving the practice every day knowing that they have given someone a reason to smile makes their job worthwhile. There we go. All right, so, Dr. Masoodah Essop, how are you?
Hi. Well, thanks. How are you?
I'm good, thank you. I changed it a bit there because it said that you were a he, but I can clearly hear that you are a lady.
Yeah.
So how are you? Good to have you on the phone and good to have you on the line to talk to us about, of course, World Oral Health Day and the importance of that. And did I miss anything out in your bio? Is that correct?
Yeah, no, everything seems spot on. Thank you. Thank you very much.
So Mill Park Hospital, where's that?
It's in Auckland Park in Joburg.
All right. Okay. All right. So we're going to get into our conversation for today. So, Dr. Essop, why can't I just pull the tooth if it hurts? I mean, if I've got a sore tooth, should I just pull it, or what should I be doing?
Definitely not. There is a time and a place that teeth do actually need to be taken out. But your teeth are just as important as any other part of your body. And you wouldn't just walk into, the doctor's rooms and say, my finger is cut, can I just chop it off,
Yeah.
So teeth add, just like any other part of your body, it adds to the whole balance in your body. And extracting one tooth causes or leads to an imbalance in your body, and that then opens your body up to a whole host of other problems. So once you have a tooth missing on one side, you will actually find that you favor the tooth, the side of your mouth that has more teeth, unknowingly. And then you cause overuse in that area, leading to teeth on that side of your face needing to be taken out. So it's really a ripple effect. So if teeth can be saved, it's always worth your while, worth your time and your efforts to actually rather save the tooth than just pulling it out.
Yeah, it's not like the tooth is going to grow back, right?
Exactly. Or if you do have to take it out, it's always in your best interest to get that gap closed by a bridge or a denture. Get a prosthesis made so that you're not just left with a gaping hole. I tell my patients, there's a reason why you have 32 teeth in your body and not 2 teeth and 32 eyes.
Yeah.
Because you need 2 eyes and you need 32 teeth. So, try to replace it if possible.
I like the analogy of going to the doctor and not wanting to cut off your finger. That's a good analogy.
Yeah.
It makes sense. Dr. Essop, why do dentists say that we need to go for a checkup every 6 months? Why is that so important?
So, that's a great question, and it's really important because, when it comes to your body, if you have a headache, you'll take a painkiller and your headache will go away. Or if you have a chest infection, you'll take antibiotics and you'll treat the infection, which is treating, the symptom, which is the sniffles and the runny nose, or as well as the cause, which is the bacteria that's causing the infection. But with the mouth, it works differently because what happens is, you end up not feeling any pain in your mouth until it's too late.
Yeah.
So by the time you reach the dentist, when you are in pain, what they're gonna, if you just take medicine, it's just gonna treat the symptom and not treat the cause. So by going for your 6 monthly checkup, what you do is you're going to treat something before they, treat damage in your mouth before there could be damage that's irreversible, such as like you asked earlier, why can the teeth just not need to be pulled out? So if you go when it's too late, the tooth will need to be pulled out, and then now we're stuck with, now we don't have a tooth in that area, and problems that lead to that, with that. So going for your 6-month checkup is a way to prevent damage that is irreversible by treating it, as soon as there is a symptom.
Okay, so we were talking earlier about pulling a tooth out, but if my tooth hurts, should I be coming to the dentist immediately? What should I be doing?
Yes, 100%. And that is, like I just mentioned, now, that is because when your tooth hurts and you take a painkiller, or when your tooth hurts and you go, a lot of my patients out there will tell me that, oh no, I had like an abscess, my mouth was swollen, so I went to a GP doctor, and they prescribed antibiotics, and I was fine, so I didn't have to come back. So that taking an antibiotic or taking a painkiller is only treating the symptoms.
Yeah.
But by going to the dentist immediately when your tooth hurts, or preventatively with your 6 months or with your 6 month checkup, what you do there is you're able to treat the cause of the problem, which only a dentist can do, by either doing a filling or a root canal therapy treatment, or whatever it is that is causing the pain. And by, treating the cause of the problem, you will cure the symptoms.
If you have just joined us, Clicks Live, Revitalizing Radio. Stephen Taylor with you, and talking to Dr. Masoodah Essop, of course, all in conjunction with World Oral Health Day, which took place on Monday. Of course, kind of World Oral Health Month as well. Dr. Essop, teeth and digestion, what's the connection?
So teeth and digestion is actually, I think it's actually something that is so commonly overlooked. People, I know in this day and age, every second person is suffering from acid reflux problems.
Yeah.
Or commonly, indigestion, needing Gaviscon every second day or after every meal.
Yes. And
they realize that the mouth is actually the first port of call for digestion. Food enters the mouth, and it enters, as we call it, bolus. It mixes, as you chew, it mixes with the saliva. And those salivas actually have enzymes in it that break down your complex carbohydrates, your starches, right?
Yeah.
So if you don't chew your food properly, you're actually messing up the first phase of digestion. So, say for example, you inhale your food because you just put the food in your mouth and you swallow, so you finish your meal in 5 minutes.
Yeah.
You're not allowing your time. You're not allowing adequate time for you to chew your food properly, to allow the saliva to actually allow for that first phase of breakdown that happens in the mouth. And what can you tell me that if you mess up a system from the get-go, what's going to happen at phase 2 when the bolus enters your stomach? When that food enters your stomach, it is not adequately broken down. And if it's not adequately broken down, your stomach is going to have to work twice as hard to break it down there.
That's it.
And we all know that in your stomach, how food is broken down is by release of acid, hydrochloric acid. So now your stomach is releasing way more acid to break that food down, and that is actually what's causing your acid reflux, your indigestion problems. Obviously, that's not the only cause, but it is definitely a predisposing or precipitating factor that could lead to indigestion for many people. So definitely there is a connection between teeth and digestion. And I mean, listeners at home, try this. Just take time to actually concentrate on chewing your food. My friends laugh at me because I tell them, please chew your food 32 times. And try it. And you'll chew your food 32 times and you'll feel like it's almost like water going down your throat.
Yeah.
But don't feel bloated afterwards. There's no heaviness. If you're actually deliberate with chewing your food and savoring your food in the mouth, in the tasty phase of eating,
Yes.
you will see the difference it makes to just digesting your food.
Enjoy your food rather than just eating it.
Yeah, exactly.
And tell me, Dr. Essop, does acid reflux, and as you've just spoken about digestion and stuff like that, indigestion, does that cause bad breath as well?
That can definitely lead to bad breath. There is a couple of factors that lead to bad breath. If you have bad gums or bleeding gums, your gums should never bleed. And a lot of my patients will come to me and say, "No, my gums bleed every so often," So I always tell them, "Well, do your feet bleed when you walk?" And then you tell me, "No." So I said, "But if your feet had to bleed when you walk, wouldn't you tell me that there's a problem? You'd go immediately to the doctor."
Yeah.
So it's the same thing. Your gums should never bleed. Obviously, if you brush really hard one day and you've accidentally hurt your gums, that's different. But generally, day to day, gums should never bleed. So bleeding gums, we say inflamed or swollen gums causes bad breath. Also, when you have digestion problems that will cause bad breath, it's always best to seek medical advice. If you feel like you do have a bad breath problem, speak to your dentist, and generally we're able to sort the problem out really, really quickly.
Okay, and why do I have to save my children's teeth? What is important about that? Because at the age of 5, 6, they fall out anyway, don't they?
So, like I mentioned, there's a reason God gave us 32 teeth.
Yeah.
If he didn't want us to have something, he wouldn't give it to us.
Exactly.
That's what I would. So it's the same thing with the children's teeth. So adults are given 32 teeth, and children only have 20. So you can see that, and obviously, you've come across a child and you know that their teeth are a lot smaller.
Yes.
So teeth play, for a child, teeth play a function of, an important role in function, which is your mastication, your chewing, and then in chewing comes being able to eat harder food, such as your chicken and your steaks and your food that is generally high in proteins, crunchier food, peanuts, stuff like that.
Yes.
So with function, the teeth also aid in speech development as well as aesthetics. Speech development, if they don't have teeth at the bottom or teeth at the top, they aren't able to say the T's nicely, they aren't able to say the S's nicely, and the D's, anything that require them to put their tongue behind their front teeth. And then with aesthetics, it doesn't matter what age we are. We are living in such a a very, I don't want to say fickle society, but a society that is very, very rooted on aesthetics in this day and age.
Yes.
So I find that aesthetics play a major role in a child's self-esteem. And you don't know, but maybe a child or a toddler may be going to nursery school, kindergarten, kindergarten, grade 1, and they get teased about having black teeth or rotten teeth or no teeth. And children are very impressionable at that age. So a child that you may find, wanting to come out their shell, get teased about those things, A, it isn't nice, it's unnecessary. But B, it'll leave a lasting impression on them, which we don't want,
Mm-hmm.
So,
absolutely.
yeah, so as much as vital and important, as teeth are for adults, teeth are equally as important for a child. And just saying that because they're going to get another step, it's not important, is not a right a way to think about it.
No, that's true. Tell me, I was going to say something now, but I forgot. Okay, anyway, it'll come back to me. Oral health, we're talking about oral health. Welcome if you have just joined us. Stephen Taylor with you, chatting to Dr. Masoodah Essop. Doctor, if my child falls and knocks his tooth out, what must I do? Should I call the tooth fairy?
That's a really great question, and I think that is something that people don't have enough knowledge about and are not so as aware about as they should be. So if a child, I'm talking about toddler from the age of about 3 or from the age that they first have teeth.
Yes.
Okay, so 10 months and above, 8 months and above, to about, for whatever age. If you knock out your tooth, even you as an adult, you get into a fight and they say, don't go for the face, but they went for the face and they knocked out your front tooth. Find that tooth and rush to your dentist. Your dentist is more than qualified. If you see that, obviously you can rush to your dentist. You can take your child to the dentist and try to get there within the hour.
Yes.
And so what you'll do is you will place you'll just gently dust off any dust, any like sand or whatever from the tooth. Try not to wash it underwater and place it in a little container of milk. Or if you can, just put it in a container and spit in it so it's in the same medium. The saliva acts as a medium to preserve the tooth. And rush to your dentist. If you rush to them within the hour, there's a very good possibility that if it is a permanent tooth, they can re-implant it with success.
Wow.
So, we may be able to save the tooth. We won't be able to save the nerve, so you'll have to undergo root canal therapy for that tooth. But you will definitely, there's a high possibility that you will be able to save it. And in the case of a child, even if, they knock out, we say a valve, where their complete tooth is knocked out, we may not be able to re-implant the tooth, but it's very important for us to check that child because, first of all, we are able to diagnose if they have a concussion or whatever.
Yeah.
But secondly, we can check. They may have fractured in that fall an entire segment of their dental arch. So it's very important for us to check for that. There's a thin bone that actually holds the tooth in place. That's called the alveolar bone. There's a chance that could be fractured, with fragments of that being loose in the mouth. That would need to, be fixed as well. So if you do knock a tooth out, it's very important. See your dentist. It is regarded as a dental emergency or as an emergency. Don't go to casualty because casualty won't necessarily know what to do and will tell you to go to the dentist tomorrow or whatever.
Yes.
And that is actually way too late. If you would like to if the tooth was able to be reimplanted, it will no longer be able to be reimplanted. So try and get there within the hour. As a parent, like now that you know this, like inform your kids. If you have kids at a school, inform their teachers that if this ever happens to my child, you rush them to the dentist with their tooth. And the dentist will make the call as whether they can be saved or not, but within that hour.
Okay. That is the disclaimer you mentioned about fighting earlier. We shouldn't be fighting. We should be sharing love, rather. But I know that you were just giving an analogy, man.
Yes. No fighting.
Yeah, there you go. And then what I wanted to ask you, what is aesthetics for those people that are not doctors? What does aesthetics mean?
Oh, geez. Aesthetics is the way you look.
Oh.
The way, yes. It's not necessarily it's the way you look. It's everything about you.
Okay. Okay. No, I learned something. All right, Dr. Masoodah Essop, any closing thoughts from yourself and how can listeners contact you?
So I am based in Johannesburg at Mopark Hospital. I work for a private practice called Fresher Breath. If they Google Fresher Breath, they will and Google Mopark Hospital, they should be able to find me and reach me. My telephone number is 011-480-7203. Yeah. What else? Final thoughts. Final thought is please generally teeth genuinely are a big deal. It's the first thing people notice, and it's something to be so proud of. And even when you think that, no, my teeth are bad or I have bad genetics and that's why my teeth look like that, I'm sure you will find a dentist that will be able to help you. And we are all willing to play our part to make your smile, your smile something to be proud of. And that's what actually, sets us, makes us feel good. So yeah, just know that if you are listening to this and you need help, there will always be somebody there to help you with your smile and want to make a difference, because that's what genuinely makes us happy as practitioners.
I love that. I love the name, Fresher Breath. Such a simple name, but such a cool name as well.
Yeah, it is.
So Fresher Breath, private practice situated in Mill Park Hospital, 011-480-7203. Dr. Masoodah Essop, thank you so much for your time. I really appreciate it. And please keep up the good work that you are doing.
Thank you. Thank you very much, and thank you for having me.